great background. We're about to switch now to a sort of a structured Q&A where we're going to have some targeted questions to some of these participants. So Divya, we're going to start with you. I know you're med school bound, but you decided to pursue a Fulbright before beginning medical school, and I'm curious as to why that is. What was your thought process like? What was your application process like? What were the challenges? And what have you really learned from being in India this past year? Divya, are you still with us?
Yeah, sorry, I muted myself, so I had to unmute myself.
Okay, no problem.
Yeah, so I decided to apply for the Fulbright because it had always been in the back of my mind, just because Northwestern has a really great fellowships office, and so I knew that the Fulbright would give me a lot of flexibility to do the type of work that I wanted to do. For those of you that don't know what the Fulbright is, it's basically a State Department-sponsored fellowship that sends students and researchers to different countries around the world. And so I chose India because India has a really famous family planning program and starting to really get its work together around with HIV and AIDS. And so I knew that through the Fulbright I could do research, or I could work in program, basically on my program implementation. So the process itself wasn't as intensive as I thought it would be. Basically, you have to find an affiliation with an organization in India. So I chose the Freedom Foundation, and the way I found them was basically just emailing a lot of people. I spoke with UNAIDS a lot, which is the UN AIDS coordinating body, and they recommended me to my NGO, and I had to write a proposal. I had to write personal statements, and it's a long process of fighting who gets the Fulbright, but
Right.
Once you get it, basically you can do whatever you really want on the ground. And so, like I said, I'm doing research. In terms of what the experience has taught me, I think above anything else, it's taught me to be really flexible and patient. And I know that they tell you in any global health experience that you have to be really open to change. I don't think you realize the challenge of that once you get in the setting and really immerse yourself in the culture. It took me a really long time to get my bearings here in India. You know, it's a new professional culture, especially coming straight out of college,
Right.
and not really knowing what my true skill set was. It's a different culture, and I got a lot of resistance for the type of research that I was doing. And I'm not quite sure people really knew what I was doing, and so it takes a lot. So it took me a long time to kind of realize how I needed to present myself, and obviously my research proposal from the original has changed a lot. But I think in all of those changes, and in kind of learning how to be really flexible with myself, you also learn how to be kind of stubborn. You get really good at arguing with yourself in these types of situations, and so I think on one hand, where my work has changed a lot, and I've been really open to that change. I've also really learned what's kind of important to me in global health work, and it's really taught me how to stick to my principles really well.
That sounds amazing. I'm curious, did you explore other options when you were making a decision about when applying to the Fulbright? Did you consider other fellowships, for example, or did you know that you wanted to take a gap year between undergrad and medical school? What was the thought process for selecting that path?
Yeah, I definitely knew I wanted to take a gap year. I didn't think I was quite ready for med school, and I didn't really know if I wanted to go to med school. I knew grad school was in the future, but I wanted to take time just to kind of explore something else and kind of be shocked by another experience.
Right.
So I did explore other options. I applied for, other volunteering positions. I applied to other NGOs and nonprofits, had a few interviews and stuff, but by the time I had been accepted for the Fulbright, I just kind of knew that I really wanted that experience, so I ended up choosing that.
And it sounds like it's been an amazing experience with that. Let's shift gears a little bit. Maggie's had a very different experience. Maggie, you have really done some amazing work, both as a student in an MPH program and also working really in the workforce. And I'm curious if you could please elaborate a little bit more on how you applied to MPH school, since you are our only MPH candidate here, and the reasons why you decided to pursue an MPH at this time, and how you went about selecting that focus.
Yeah, absolutely. So for me, similar to Divya, I knew that I absolutely wanted to take a little bit of time off before going to grad school. I had a feeling I wanted to do an MPH, and I had a feeling that I was interested in community health, and I told people that, but I don't think I really understood what urban community health was or what that even meant. So I started working in administration in a community health center in Chicago, and basically worked as sort of the management team catch-all. So I got a chance to see sort of every aspect of how a community health center runs and like how they operate within the community and politically and operationally, and got a feel for like what the terminology is, what these words mean, who the people are, and how they connect with one another. And that was immensely helpful in informing my both my decision to get an MPH, and also my application and my process in terms of how I applied, where I applied, and what school I chose. And so for me, I think that there were multiple routes I could have pursued, but for me, an MPH was sort of almost treating myself because I knew it was what I was really passionate about, and it's what I really wanted to study. So I'm focusing on health behavior and health education. That's my department, but there are multiple departments that one could go into in public health school. And I could have done something a little more geared towards management and administration, since after kind of working, I had decided that I thought that I was well placed there, and that's what I wanted to pursue professionally. But health behavior and health education was something that just sort of fascinated me in terms of creating like community health programming and really looking at health issues from all angles, so the personal level and individual level, all the way up to the social and like policy levels, and kind of seeing like how broader structures affect people's health decisions. And so this sort of gave me a chance to go that route. But I should say that there are many other ways to go about pursuing like graduate school in public health. So one could do epidemiology or biostatistics or nutrition or maternal and child health, which tends to be really popular among people who like to do international work. And so for me, I just sort of went with what I knew I was going to absolutely love while I studied it. And I am hoping that it will assist me in the end professionally as well. And I think it will, in part just because having a master's degree is really helpful, but also because I sort of have an understanding, or I'm gaining an understanding of how community health programming works sort of at the ground level that I think I can use to inform work I might do in administration. So that was sort of my path and why I chose to go that route.
That makes a lot of sense, Maggie. And I'm actually going to dovetail into a question that was sent in earlier by an anonymous student. I'll just read it point blank. I think this kind of dovetails to what you were just saying. So looking back when you made your decision about